Rick, if I have a client calls me and they say that they've been involved in a debilitating accident that's caused them to have a back fusion, can you explain what that is?
Yes, Kevin. We brought this model in that we use in cases from time to time, and this is the low back spine called the lumbar spine. And in a fusion surgery, what they're doing is they're removing one or more of the discs between the bony part of the vertebral bodies. So, everyone knows that these discs are like a very strong jelly-like material. So in a fusion, it means they're removing what is left of a bad disc, and they're fusing together bone. And there's different ways doctors do it. The prominent ways we see are there's hardware, they call it. There's metal up and down the spine that is screwed at different levels into the spine, and it fixates the spine from movement. So the main thing for people thinking about what are their restrictions physically after a fusion surgery are they have to be aware that one or more jelly-like discs are gone, and they're fusing the spine. That means the movement in the spine that the disc allows is gone in that area. So there's a little more pressure above and below that area on the discs, and obviously a person isn't going to be able to move and twist like they did before. So usually physical therapy is prescribed for some period of time, and then different people respond differently. How some persons will respond and how it's a little unpredictable, but the pain level is usually reduced, and there are some lifelong restrictions to plan for.
And so you mentioned some of the restrictions, and I would assume that these not only go to their work, whatever that might be, but also their home life. Can you discuss how we might go about recovering for some of those restrictions?
Well, the doctor, of course, is in charge of that. After physical therapy, sometimes there are home exercises. The biggest thing is the mobility in the back has to be relearned, because that area where the fusion surgery was is just not twisting or moving like it used to. There will be lifting restrictions. There will be restrictions on movements over the shoulder with the arms. You're not going to be lifting anything significantly heavy any longer after a back fusion surgery.
Thank you.
Please go to our website at hsinjurylaw.com to immediately receive by email our free report on how medical evidence presentation can win cases. If you or someone you know has suffered a serious personal injury, please feel free to contact us by going to our website or calling our 1-800 number.